Hey guys, I'm Dr. Jeremy,
Dr. David here.
and today we are going to be talking about spinal pain and the different ways to diagnose spinal pain, isolate where the real problem's coming from, and then also that helps us work out how to best get results and help you guys manage that pain and obviously have a better life if you can manage pain. So spinal pain is very interesting, but as I was reading some research recently, an interesting fact was in one of the articles, and it showed that where the nerve exits out of the little hole in our spine, and this is actually a disc and this is a vertebra, and obviously that sits in our neck or in our low back, but the little hole, if this top bone moves less or around about 3 mil, we know that about 45% of the hole of where the nerve actually exits, 40 to 45% of that hole where the nerve exits can be obstructed. And that's only with a 3 millimeter movement, which is crazy. And a 3 millimeter movement can happen with degeneration or osteoarthritis, or even there's lots of other things that can cause that small movement in our spine, and a 45% reduction of space for that nerve, which is crazy considering that nerve supplies things like our hand, our finger movement, our leg, our muscle control, our foot movement, for example. So important that we don't let that degenerate and wear out.
100%. So all the symptoms that Dr. Jeremy just talked about, when someone comes in here to see us, we look into their history. So what has happened before, their imaging, something that they might bring in, or something that we send out to try and investigate what was going on, as well as the presenting symptoms. So we get all this information. So we're trying to find a diagnosis, and we're trying to find a tissue lesion, and then we're going to go treat it accordingly. So for example, when we have a degenerative disc, when we have a disc issue, symptoms can go from your neck to your arms, for example. When you have a low back issue, it can go from your low back to your legs to your foot as well.
Correct. So what Dr. David's saying is when you come in, there's, as well as the presenting history and also imaging that we might get, there's lots of specific questions and tests that we can do or ask or perform the tests in here to actually work out exactly what tissues in lesion and what's going on with you, and that way we can best decide what the best treatment or form of modality to help manage that pain may be. That way, when we run these specialised tests, we are much better able to get quicker, better, more efficient results with you guys, or send you off into the place where you actually need to be.
100%.
So, beautiful. So if you guys have got any pain, neck pain, low back pain, dysfunction, pain in your limbs, loss of muscle movement, pins and needles, anything like that, do not put up with it, because as you've seen, it doesn't take a whole lot of degeneration in the spine, which is now in the research, to actually exacerbate and make these symptoms a lot worse, which of course is going to have a massive impact on your life, guys. Things like sport, just being able to relax without being in pain, Dr. David.
Oh
the
yeah,
list
I
could
know.
go on and on.
Alright, so I don't actually have anything to
Anything
add
to
on.
add? I'm pretty happy with that.
Yes.
So if you know anyone, guys, send them in. Let us have a good look at them. They're going to be in safe hands. If we can't help them, as always, we'll let them know straight away and get them to the place where they need to be.
Alright.
Have a great weekend, guys.